Thank you. First of all, I just want to thank you so much for inviting me to play this role for such a distinguished group of many people I have a great deal of respect for. So thank you. And the speakers were absolutely fantastic. Gave me a lot to think about. The other thing I wanted to say is that I thought I'd come in here and I'll just do an overview and give that back to you and it'll spur discussion, but really you're going to hear everything today from a Sabrina perspective. It's all being filtered through Sabrina. So you invited me, so this is what you get. The first thing I wanted to say is that I'm just the field has come such a long way. It's really amazing to see where this field is now, and that there are folks that have presented today that have these titles that I have coveted for years: Director of Health Literacy, Health Literacy Coordinator, Director of Education and Health Literacy, Senior Health Literacy Specialist. I mean, it's amazing. So there is a real field here of study, a group of professionals, and I think that is something that just marks how far we've come. So how many folks here have a title that has health literacy in the title? Okay. Now, while we have those folks in those positions developing, the majority of people in health literacy still, are other professions first. So I think that's significant. We have a lot of new people coming into the field, and that's something to consider. Because what I heard today is that people really make a difference, right? Leadership is the first attribute, engaging your leadership, and that is critical, really critical to moving every single talk I heard today, moving an initiative forward. Engaging leadership was key. But it was the health literacy folks, or the folks that felt like a fire in their belly about doing health literacy work, being turned on by this work and really, believing in equity and wanting to do, being sure that people understood and were able to act on information for themselves, is really what makes the change. And so I feel like that's something that we have to keep in mind and support those folks to continue doing this work. Another theme that came up was just tools. So what do these folks need to do their work? Tools. They're using health literacy tools. There are a lot of tools out there. We heard about teach back, confirming understanding. We heard about creating an environment for question asking. Plain language clearly, and then even kind of a new one, this, what is it, the med picks? That was, yeah, I'm actually, okay, so that's like a new intervention. We've got the universal toolkit, which, folks are really responding to that. One thing what I don't hear that we have really is professional development for folks in the field, and that kind of goes back to that first, point around the folks that are really doing this work. So I feel like we have a lot of tools, but we maybe need a place to bring them together so that new folks in the field know where to go to get them. So it's not kind of like going online and Googling health literacy because you just got this new great job at this hospital doing health literacy work, but this is new, you're really excited about it, but you're new to the field. So that's just something also to consider. Evaluation. All right, that was also something that I feel like, and that goes back to supporting the folks that are doing the work in the field, is to provide folks with, technical assistance around and training and resources around evaluation. I just gave a talk in Wisconsin on health literacy program evaluation. And, I'm talking to practitioners, and we're talking about, just think about do evaluation, first of all. The second is plan your evaluation while you're planning your program, so you're doing them simultaneously. You're not like figuring out your project, what you're going to do, and then adding evaluation onto the end. But we're talking about real, basic things like measurable objectives and, what is a logic model. So the field really could use some support with evaluation. I feel like we have a pretty growing and strong research base, and that's really gotten us to a great place, and it's really helped us develop our field, and we continue to need to do that. but still we are still an emerging field, and we have some work to do. The other thing I felt was missing, and one of our speakers mentioned this, actually, Karen from rural Maine, talking about engaging the community. So I feel like that is perhaps, there was a question, what attribute, I think Ruth might have asked that question, are there any attributes that are missing? So I feel like engaging the community, but community partners, like healthcare can't do it all. And healthcare is one half. You really need educated and engaged patients coming in and engaging in that dialogue and that decision making, and we really could use our community partners, our community-based organizations that may or may not be, health-oriented. They could be social service programs. They could be community health programs, but not necessarily public health. So that's something else to think about, and in terms of the attributes, that's something to think about. And related to that is the issue of culture and literacy and language. A number of programs, talked about how critical that is, linking the two, how you really can't do, health literacy work without, paying attention to language issues, language access, literacy are completely tied. So I feel like we need to emphasize that more, and the Roundtable needs to really take that on. Have we done a culture, language, and literacy Roundtable yet? Maybe that's something to think about. The other thing is that now that we have I guess I'll call them the HLO standards, we might want to look at how do they match up with the class standards, and is there any synergy there or support? I don't know. It's just something to think about, how important that relationship is. And in terms of training, training was a huge theme here. One of the things I feel like is often missing from training is training health professionals how to work with interpreters. We're always training interpreters, and that's really important. And we need to work with interpreters and train interpreters in terms of health literacy and learn from interpreters in terms of language access and culture. But we need to train our health professionals how to work effectively with interpreters. Technology came up a number of times. I think we need to think about, I didn't hear a lot around social media and new technologies, too much, a little bit, but that's something that information access might be, related to, and that is related to kind of the other side of the equation. So really working with building the health literacy of the nation in terms of folks' skills, in terms of how do I access information? How do I evaluate that information? How do I, find the information to start with, and then, how do I actually use that information to make decisions? And so those are real skills. If people don't have those skills, you can't give those skills to the folks like in, patient-provider interaction. So I think that working with the community might really help with that. So I think that's a key message in terms of how does this roundtable support the development of the field and the continued growth and sustainability and quality of the field, really. I mean, just this last couple of people talked about, standards. There are a lot of new people in the field that wanting to do good work, but how do they know they're doing the right thing? This group might be a leader in that. I also want to put out there is a discussion going on about a health literacy association. Now, a health literacy association is not very sexy, because, you're working towards, supporting a lot of professionals, right, your colleagues in the field. So it's not a sexy thing. But I really feel like at this point our field needs a professional association. We need to take ourselves, in the field, seriously as a profession. I don't think we're going away. People are going to have health literacy as their title, and they're going to be health literacy professionals. And we have a few health literacy professionals, but that's going to grow, and we need to support those professionals. Everybody in this room really is a health literacy expert, and there was someone who said, I think it was Laura, said, there are not enough health literacy experts out there. Okay, there's a good, here we are. but we're not that many, and we're not going to be around forever, and we have a lot of experience that to pass on to new folks that are coming into the field. So the question is, how do we do that? And that could be a role of a health literacy association, that whole idea of mentoring and passing on what our experience. I think with that, I may have be saving us some time, George, in terms of catching up. But that's basically what I wanted to share, and if I remember something else, I'll add it during the discussion.
All right. Now, Sabrina, you have done an excellent job of setting the tone for this last part of the conversation.